What are early maladaptive schemas in schema therapy? Imagine carrying around invisible emotional backpacks filled with old beliefs and feelings from childhood. These are what we call early maladaptive schemas. They are deep-rooted patterns of thinking, feeling, and acting that start forming when we are kids or teenagers. These patterns stick with us into adulthood and shape how we see ourselves and others. In schema therapy, we focus on these patterns because they are often at the core of ongoing emotional struggles. These schemas develop when our basic emotional needs, like feeling safe, connected, independent, and able to express ourselves, aren't met during childhood. For example, if a child feels neglected or ignored, they might develop a schema of emotional deprivation, believing that no one will meet their emotional needs. Schemas are not just thoughts. They include memories, feelings, and even physical sensations. They influence how we interpret events and how we behave. Someone with a schema of defectiveness might constantly feel they are flawed or unworthy, which affects their relationships and self-esteem. These schemas often operate automatically, without us realizing, and can lead us to seek out situations that confirm them. For example, a person with an abandonment schema might unconsciously create situations where they feel rejected or left out. These patterns stay dormant until something triggers them, like a disagreement, rejection, or feeling misunderstood. When triggered, they can cause intense emotions and lead to behaviors that keep the schema alive. In therapy, we use tools like the Young Schema questionnaire to identify these patterns. Once we know what they are, we work on understanding their origins and how they influence current life. Therapists help clients notice when a schema is active and challenge it. We might keep a diary of events that trigger these schemas or practice new behaviors that contradict old patterns. Experiential techniques like role-playing or guided imagery help clients process emotions linked to their schemas. The goal is to develop healthier ways of meeting emotional needs and to weaken the power of these old patterns. From an advanced cognitive behavioral therapy perspective, early maladaptive schemas are overlearned, automatic responses that keep psychological issues going. Traditional cognitive behavioral therapy often targets surface thoughts and behaviors, but schema therapy digs deeper into these core themes. It uses structured assessments and interventions to help clients recognize and change these long-standing patterns. For example, a client with a schema of mistrust might work on recognizing when they expect betrayal and challenge that belief. They might practice trusting others gradually or develop self-compassion to counteract feelings of defectiveness. The process involves understanding the schema's origins, seeing how it influences current life, and learning new, healthier ways to respond. In summary, early maladaptive schemas are persistent, negative themes rooted in childhood experiences. They shape how we see ourselves and the world, often leading to emotional distress. Schema therapy provides practical tools to identify, understand, and change these patterns, helping people feel more secure, connected, and confident in their lives.